Thank you very much. Good afternoon, ladies and gentlemen. A few words about SAP Health first. SAP Health is a global division of SAP, and it's the division responsible for bringing the power of digital technologies to the broader healthcare industry, including life sciences, medical devices, labs, providers, and payers as well. I feel very privileged to be among you today and also quite excited. I've been working at the intersection of technology, business, and strategy for the past 20 years to promote innovation, and I'm truly passionate about the potential impact of digital technologies in healthcare. Let's consider our daily lives for a second. 4 examples. Take education. Consider that more than 25% of college students today are enrolled in at least one online course. Technology has changed the way we access and acquire knowledge. Consider relationships. Together with social media, we're more connected than ever. We can stay in touch with childhood friends, people we haven't seen for a long time. And here's a startling statistics for you. Over 90% of single adults in the US have tried online dating. I mean, good or sad, you be the judge. But it's quite remarkable. Labor, the way we work. Think about the productivity gains of tools like workflow automations, robotics, AI, and finally transportation, how we move. Take the example of Uber, with over 44 million riders in 77 countries. When is the last time you hailed a cab? So the point is, technology has had an undeniable impact on our lives. And for the most part, it's made our lives easier. Well, at SAP, we're pretty lucky because we've been at the forefront of this change, and we've helped over 25 industry sectors navigate their own digital transformation. I could pick a lot of examples, but I'm going to highlight 2, which for me truly highlight and exemplify the power of digital and what's to come. First, in Karlsruhe, SAP partnered with the city to implement a vast network of lampposts. We equipped these lampposts with sensors to monitor traffic and air emissions. And by connecting these lampposts as a network, we enabled the city to respond in real time to improve traffic and reduce pollution. Second example, we recently partnered with a company called NTT to build a solution that monitors biomedical signals and data from the driver, including posture. And we combine this to a GPS data location set. And as a result, you have a solution that allows you to monitor holistically safety around the journey, to recognize signal of the driver's fatigue, and potentially to address any type of threat on the road proactively. So the point here through these partnerships is that digital technologies have matured to the point where they can start addressing meaningfully some very broad and serious issues in our societies, just through these 2 examples: pollution, air quality, safety. But let me ask you a question. Are we seeing the power, the transformative power of digital technologies in healthcare? And let's consider 4 statistics from the World Health Organization. First, 1 in 6 deaths is linked to cancer. Diabetes, over 400 million people suffer from diabetes globally, and an estimated 50% are left undiagnosed. 50%. Cardiovascular diseases represent the leading cause of death, with over 17 million deaths in 2015. And finally, consider chronic diseases. Together, they represent 7 out of the top 10 causes of death. So, sure, we're seeing good innovation in healthcare, good digital technologies coming in, being consumed, and everybody will point towards the digitization of the patient record through the EHR. It's a great step. It's a fundamental step for future progress. But we can agree that we haven't yet seen the full impact of digital in healthcare. And why is that? At SAP, we believe there are a couple of reasons, but I will highlight 3 specifically that are very pertinent to our topic today. As highlighted by my colleagues earlier today, fundamentally, even in the context of shift towards value-based care, the economics of our industry still rewards treatment. We're focusing on better diagnostic, better care delivery. And as a result, we've massively underinvested in wellness. We're fighting the fire as opposed to preventing it. This focus on treatment has resulted in an innovation that has been really focused on better devices, better tools, better hardware. But we haven't invested equally in software. And as a result, we end up across our industry with very immature IT technologies and infrastructure as it comes down to workflow education and data management. And this immaturity is clearly manifested in the fact that our tools are disconnected from an IT standpoint. Systems do not talk to each other. The data doesn't flow. And this disconnection in the context of an industry that's highly regulated with very sensitive data fundamentally limits collaboration tremendously. So, what is the cost of these challenges on care, on quality of care for patients? And here I'm going to highlight for you an example that we can all relate to: cancer. Obviously, we're all touched by cancer directly or indirectly. And when you suffer from cancer, you would expect your doctor to be able to leverage large data sets inside his organization as well as external data, tumor registries, clinical trials, to be able to get to the best informed possible decision about your care. Unfortunately, these decisions are far less data-driven most of the time. Consider that only 5% of cancer patients are enrolled in clinical trials. So as a result, physicians, oncologists have had to extrapolate from narrow study findings and rely a lot on their experience. It's certainly a good start, but we can do much, much better. And at SAP Health, we participated on this fight to improve cancer treatment through digital technologies. And I will highlight for you the journey that we undertook. The journey starts with our friend at Charité, one of the largest university hospitals in Europe, where we built with Charité a fully integrated and granular data sets of all the patients that Charité has ever treated. And we allowed a structured access to this data through an easy-to-use interface. And with this solution, the oncologist can basically query this internal data, local case history, to get to a more informed decision about the care of his patient. The journey continues with NCT in Heidelberg, where we leverage our technology to detect tumor markers in pathology reports and doctor's notes. So here, the step goes further. While sitting in front of the patient, the oncologist can actually access not only local data, but also external data through tumor registries to get to the best possible decision. Third, with the American Society of Clinical Oncology, we're helping ASCO power their Cancer Link initiative. The Cancer Link is basically a tool that combines clinical data from a very wide range, wide population of oncologists. At this stage, we've collected data from over 100 clinics, and the data set represents about 2 million lives. So with this step with ASCO, what we've done is we've engineered a network effect through very large data sets. And now, more recently, with the IGR, Institut Gustave Roussy in Paris, we are combining clinical and genomic data for about 300,000 patients. And this is just the beginning. We're absolutely pursuing the aspiration with IGR to extend those capabilities to a broader network of cancer research centers in Europe. So what are we seeing here? What am I trying to tell you? Here what you're seeing is essentially the power of a data-driven, network-driven strategy. You're seeing institutions like these elevate themselves beyond their own agenda in order to improve care globally. And at SAP Health, our division, we're both thrilled and privileged because we can engage in similar journeys on many, many diseases and multiple patient-centric use cases. And so we regrouped with my team and we asked ourselves, okay, what can we extract from these journeys, from this capital of experience that can be applied more holistically to healthcare to maximize the impact of digital? And we came up with 3 observations, 3 lessons learned that I will share with you. The first one is about data, of course. And it's the notion of you have to break up the status quo by a commitment to data-driven decisions. And this starts really by recognizing and respecting data as a first-class asset. From there, build a data governance process, a consistent framework on how data will be collected, managed, and shared across your organizations. This is absolutely fundamental if you want to be able to increase, scale up the leveraging of data in a secure and consistent manner. Second, connect to all data, irrespective of the format or the source system. And this goes beyond the data that resides under the HIPAA umbrella. Pursue real-life evidence, patient-reported outcomes. Finally, democratize the data. Make it available across your organization so that you can foster a culture of data-driven decisions. The next observation, the data was the what, the technology is the how. And here the lessons that I would like to share is that, look, you don't have to rip and replace your current infrastructure. We've all spent a lot establishing an infrastructure that takes us to a certain point. But here, if you want to go beyond, it's not about ripping it and replacing it. It's about leveraging and extending it through the adoption of new tools, cloud and big data solutions. But as you bring these new solutions into your environment, make sure they qualify against 3 criteria. First, they have to be open. They have to connect seamlessly to your current tools. Second, they have to be scalable. We all understand that leveraging the data is just at the very beginning, and data sets are growing exponentially, both in diversity as well as in size, fundamentally. And finally, prioritize systems and solutions that give you a chance to leverage the data in real time. And here I'm not just talking about grouping the data together, but also creating an insight that you can turn into action. Any type of latency in the steps that you need to engage into in order to leverage the data will reduce the value of this data for the benefit of the patient. So real time is absolutely critical. Final and last observation, and probably the most fundamental one, really at the heart of digital innovation, put the patient at the center. Put the patient at the center. Start from the patient when you develop a new solution. Start from the problem and then reverse engineer. It sounds obvious, but we haven't done this well at scale as an industry. Consider that there are 250,000 clinical or wellness apps globally, and only about 4%, 4.5%, if you want to be really generous, are used at scale. I mean, this is the proof that most of these applications haven't put the patient at the center when they were developed. So embrace patient-centric design principles. Engage the constituents, the patient, the support groups, families, friends, all layers of the clinical staff. And consider as well, adjacent peripheral constituents that have an indirect participation into the care journey. So I'd like to conclude today on a quote from Mr. Jobs. This quote was included in his biography released in 2011. And it's important to remember the perspective that this man brings to our topic today. Here's a man who is widely recognized as one of the greatest technology innovators of our time. And at the same time, he was also a patient who suffered a very complex and deadly form of cancer. A patient who went through a liver transplant. So his perspective is unique, and his words resonate, especially the word intersection. What it's telling us is that we need each other. True disruptive innovation from digital in healthcare will come from deeper collaboration models. And it is our collective challenge to really embrace this notion and engage into experiment, pilot, new collaboration models. Because our work together is not just about improving an industry, but fundamentally about saving lives at scale. At SAP Health, we're absolutely dedicated and committed to doing our part on this. And we are convinced that we can and will succeed if we do it truly together. Thank you.